Hello, everyone. My name is Keosha Taylor, and I am a registered nurse. I currently live in the state of Virginia, and I have been working as a registered nurse for the last 5 years. And prior to that, I was a licensed practical nurse for 12 years. I have worked in numerous fields of healthcare, from long-term care to skilled nursing, to dialysis, to psych, case management, and a few more things. I love nursing and I love helping people. In my most recent years, I have had a stronger desire for psych, which is why I am doing the psychiatric nurse practitioner program. I work at a psychiatric mental health hospital right now. I have been there for the last 5 years since I finished school, and that job is one of the main reasons why I was encouraged to do psych NP as well. I work with every age group right now in my job. I used to work with only the kids when I first started. For about the first 3 years, I did residential, then acute, and now they have changed the job to where there aren't any children on the acute building side, only residential. So I'm just working with the adults. It is a high acuity unit that I work on. It is the second highest level of acuity unit in the building, and there's a total of 6. I have been there for a while working with this particular population of patients, probably about the last 2 years on and off, whether I was working with the kids some and then permanently with them over the last about 8 months. I love psych. I don't know what it is about psych, but once I started doing psych, I didn't have a desire to work in any other fields of healthcare. I worked with the kids for so long, and I still love working with them. I just didn't want to work over there on the residential side, which is why I'm currently working with adults. I do plan to, in the future, when I am finished with school, work with adolescents again. Excuse me. And I do hope to one day have my own practice where I can practice with the adolescent population. Um, my experience with this population has been, the adolescent population has been pediatric as well. Mainly adolescent. We usually start at age 11, from like 11 to 17 in my job. And we had kids with autism. That's probably one of the slightest number of diagnoses that we had. We didn't have too many patients with that disorder, but we did have a lot of kids that self-harm, a lot of ADHD, a lot of conduct disorder, and a lot of defiant disorder. So I work with several different children that have experienced a lot of different trauma as well, and a lot of the trauma has caused them to have some of the diagnoses they have. In my particular hospital, they don't like to title the children with schizophrenia or bipolar. They use other types of diagnosis because they usually try to wait till they're 18 to give them the actual diagnosis because they don't like to label them. But I've met plenty of children that I know probably will right away get that diagnosis when they turn 18. What do you know of the pediatric population specific to health needs or vulnerabilities? I know that they are a very special population that require a very special type of person to work with them with a very special level of education and mainly just having a heart. I know there's a lot of people work with the kids and they don't do good with them. Kids are just like, to me, like animals. You know how dogs can sense good people versus people who are just there for a paycheck. So a lot of the children that I've worked with, most of the children I work with love me. I love what I do. I love working with kids because to me it's like they're the future. So if there isn't someone that can professionally help them and really mean it from the heart, then what are we there for? It's so many different areas of healthcare to work in. So why choose to work with these vulnerable children who have been through so much trauma and need sometimes just someone to be a listening ear if you don't really want to work with them? And a lot of times they can tell that. A lot of times that has caused them to have more trauma. I've seen patients actually have more trauma to come to them while they were in the inpatient setting just because of staff not really wanting to work with them. Like I said, I love what I do. I love working with kids. I love working with psych, and I can't wait to, in the future, become a psychiatric nurse practitioner and specialize in the adolescent population. Thank you.